Hey there, I haven't been on here in a while, but I wanted to bring something up that I ran into that was just a sign of blatant, power hungry corruption within the surgical field and gastroenterology. So, this is kind of a personal history with someone that I know has been having issues with gastrointestinal symptoms, lower abdominal symptoms that were sent through the workman's comp situation, and then that's another issue that I wanted to talk about is the mistreatment of and essentially malpractice cases that I've kind of run into with people that have gone through workman's comp and been over treated with or undertreated, treated too quickly. But in this case, someone close to me was essentially almost pressured through the system and into surgery for an inguinal hernia, actually a bilateral inguinal hernia. So surgery, laparoscopic surgery to repair that is seemingly somewhat minimal. It's laparoscopic, but what they do is they basically put a little ball of plastic mesh into your inguinal hernia or inguinal canal. And what that does is it prevents your intestines or whatever viscera that are in your abdominal cavity from being pushed through there, and creates scar tissue around that ball of mesh. And there are other issues that obviously are not very commonly discussed in terms of downstream consequences of creating scar tissue in a very small canal where other vessels and lymph and nerves pass through that go to your testicles and scrotum for men. So there's some significance to this story. But anyways, I was almost, I was put down because one of their doctors called me, or had the person call me in the middle of their visit, and basically was putting me down for no reason, because I wanted more objective information before this person was sent into surgery. And I looked into some of the literature around guidelines for imaging in regards to inguinal hernias. And this was posted on American Family Physician, which is a resource that I actually use pretty frequently in terms of conventional guidelines. And they have, I guess there's not an actual date on when this was posted. But surgical guidelines and diagnosis guidelines for inguinal hernia, they do not recommend routine ultrasound, which is fine. That just means that if it's obvious enough, you don't need to spend extra money to have imaging of something that you can obviously feel with your finger. However, your finger and a physician's finger, anyone's finger, is not a reliable, objective tool for measuring degree or even presence of an inguinal hernia. So after going through this article, I'll just read it to you. The diagnosis and subsequent treatment decisions for palpable abdominal wall hernias are reliably made by patient history and physical exam alone. While the use of ultrasonography has been shown to be of some benefit in the diagnosis of occult hernias, there is no place for its routine use in the setting of a clearly palpable defect, as it only adds unnecessary cost and treatment delay with no useful contribution to definitive surgical care. And then the next section says, sponsoring organizations. Society of American Gastrointestinal and Endoscopic Surgeons. So, pretty obvious that there's a conflict of interest there. It's like saying Purdue Pharma, they recommend if you have pain, just give them Oxycontin. Great. Good idea. Don't look into anything else. And trust your fingers, trust your physician's fingers, because of course everyone's fingers are objective. Anyways, this person got an ultrasound after going to 2 or 3 physicians. First one was pretty ruthless and determined that he was not willing to work with this person. The doctor was not willing to work with this patient because he asked too many questions. And God, this is just showing how broken the healthcare system is. Doctors that are so specialized and have such precision care, it's not necessarily their fault. It's just the nature of the corporate and big pharma fingers that are, and big medicine, biotech fingers that are basically guiding the structure of different hospitals and clinics and even insurance companies. So, they're not getting reimbursed for certain things, which means they're not going to go into the proper depth that they need to. And this is where naturopathic medicine is. And now that I'm in a cash-based practice, I see the importance of having the freedom to really dive into the details and getting a deeper understanding of what the heck is going on. Because most people, a lot of people that I see, not always, sometimes it's pretty straightforward, but in my clinical practice, there's typically a lot of underlying complex issues that are going on, be that infectious disease or environmental exposures or hormonal imbalances or inflammation or dietary issues, food sensitivities. Those are big ones that I see a lot. And the infectious disease piece has been a big one recently, where I've been seeing a lot of, which I'm still looking into with this person, other issues, and especially with like a lot of other symptoms going on that are not being looked into by their conventional medical doctor, but that point to immune and hormonal dysregulation that could be connected with a chronic viral infection or exposure to mycotoxins like black mold and ochratoxin, which throw off your sleep, throw off your autonomic nervous system, contribute to all kinds of inflammation and can cause cancer and can cause nerve damage and chronic pain, and anxiety and depression. Like putting the pictures together and looking for the underlying cause. That is unfortunately rarely, if ever, done in a conventional setting. So anyways, this ultrasound scenario where physicians were unwilling to look deeper on patients' request to have more objective information, imaging, which is what imaging is for, just goes to show you that there's a real problem here. All right.